This video is inspired by comments from people like yourself. Hey, and welcome back to the Cashmere Couch. This is Tulasi, and if you're new here, this is where we discuss the magic and the mayhem that is motherhood. I recently posted a snippet of a long form video. I'm going to link that video over here for you. It was a few videos ago. I posted this video with the intention of sharing my experience with a womb prolapse. So I had a very minor womb prolapse. There are different severities when your womb basically drops. And it's pretty common in women who have given birth. It doesn't matter how many children you've had, but it doesn't happen to every single person. But my intention was to educate people who would be afraid, anxious, concerned, worried, confused, which was everything that I was going through when I had those symptoms. So I shared my symptoms and I talked about what I did to assist with my womb prolapse. I also talked about the research that I did after that and my understanding of why womb health or taking care of your womb in general is so important. And so there was a snippet of that long video that I uploaded onto TikTok, and I have no idea why, but the algorithm pushed it and it went viral in a couple of days. And I got so many comments about womb prolapses, about specific conditions and specific symptoms that people were facing. I had questions about how then to care for the womb. I had questions on womb health in general, like what else can happen, why it happens. Um, I don't have children, so it's not going to happen to me. So, certain misconceptions like that. And I thought this topic deserves a whole video on its own. This is probably going to be another long video. And I'm going to try and simplify terms as much as I possibly can. I'm going to try to not talk too much unless necessary. So let's see what we've got. Grab a drink, a snack, and let's go. My apologies if any background noise gets filtered into the video. It's pretty loud outside. Okay, and so the first thing we need to understand when we talk about womb health in general, before you even understand how it is that you should care for your womb, I think it's important to look at how the womb looks like. So we're going to go through basic anatomy. All right. So in this picture, you'll see we have the uterus, we have the cervix. So the uterus is the womb, and at the bottom of the uterus, if you look at it this way, the bottom of the uterus is the cervix. The cervix always stays closed and only opens when a baby is ready to come out of the uterus. If this cervix opens beforehand for any reason or because of old age, the cervix sort of loosens up and opens, then there is always a chance that bacteria can get from the vagina up into the womb. And the womb is supposed to be a sterile environment, which means there is not supposed to be a single microorganism inside. So if anything from the outside gets in, then you have an infection. When you have an infection, depending on the severity of the infection, you may or may not have to get the entire uterus removed. When you get the entire uterus removed, we call this surgery a hysterectomy. Unfortunately, if your womb prolapses very badly, one of the options is actually to get a hysterectomy. We're gonna talk a little bit more about what happens if your womb prolapses. Of course, there are different degrees to this. If it's not that bad, then you have certain other things that you can do, which we're definitely going to look at. It was one of the biggest concerns amongst the women on TikTok. All right, so we have the vagina and then we have the pelvic floor. So the pelvic floor is basically the hammock that is holding everything. Imagine that, okay? So the pelvic floor is what you have to exercise because it is basically a bunch of ligaments. And then you also have your bladder and your rectum, which explain why women have three holes when you look down there. You have your urine or urinary bladder right in front, and then you have your uterus, and then at the back you have your rectum. So the three holes that you have would be your urethra, which is the hole from which the urine comes, and then you have your vagina, where the baby comes from. That's also the hole that you use for penetration during vaginal sex. And then you also have your anus, which is where waste comes out from. If you realize, the uterus is not stuck onto anything, it is an independent organ on its own, and the structures around it are what is keeping it in its position. So if you are going to have an a distance between the structures and the uterus, which is what happens immediately postpartum. Because imagine the uterus getting, so I thought it was like 5 or 10 times bigger. It's actually 500 times bigger. The uterus in its original state is like 1 times its size, right? And then when you have a baby, as the baby develops, it goes up to like 500 times its size. The womb getting bigger like that, it pushes all the other structures away from it. And then when the baby comes out immediately postpartum, the ligaments and whatever that had stretched out, it's just going to be there for a bit. So they may stay stretched just for a bit. And in that time, it's crucial for us to take care of the womb. That's why you have things like belly binding. That's why you have things like Kegel exercises. Kegel exercises help to work the pelvic floor. So if you want those muscles and the ligaments to shrink back to the pre-pregnancy state, then that's when womb care becomes important. If you don't do it, then there is a chance. A lot of people on TikTok were saying, oh, I'll say this to my grandmother who has had 12 children. My mother had this many kids and she didn't have a problem. It doesn't happen to every single person. If it has not happened to someone that you know or yourself, then great. But it happens to certain people, and it has happened to me. If you watch the original video from where the snippet was, you can hear about my story. I shared with you what it felt like for me, womb prolapse, and basically how I fixed it. But it's a real thing. Okay, so what is happening is that you have other hormones that step in during pregnancy. So you have hormones such as relaxin and progesterone. Again, about hormones, I have another video where I talk a lot about hormones in menstruating women. And progesterone and relaxin relax ligaments. That's their job. And so after the baby comes out, sometimes the muscles can stay stretched. It's not just the baby's weight, it's also the amniotic fluid. It's basically everything that's inside the womb. So it's not just the baby. All of these things, the pressure, the weight, tend to get the uterus to be obviously pretty heavy. And after your delivery, even if you've had a vaginal delivery or if you've had a C-section, there are differences, but both affect the pelvic floor because of the baby that was inside. It's not so much about, sometimes in some cases, there is a higher chance of you having a womb prolapse because you have had a very difficult labor, and especially during a vaginal delivery, you push too hard, and that can bring the womb lower than it should be. Um, but it doesn't mean that if you've had a C-section, you will not have a womb prolapse because the baby grew inside the uterus. I feel like this must be stressed. When the baby grew inside the uterus, everything had the chance to stretch and push and dilate pretty gradually throughout the 9 to 10 months. But when the baby suddenly comes out, it's obviously going to take about a year or so for everything to go back to normal. So that is why there is such a danger because of what happened during the pregnancy, what happened to the womb, and what has happened to the structures around the womb. What exactly the womb prolapse is? This is basically when the womb slips downwards into the vaginal canal. So look at the picture again. The womb is on top of the vagina, and your vagina is not just a hole, it's a canal, it's a tunnel, it's a wall of muscle, if you will. And so the womb slips downwards into the vaginal canal because the support system around it is weakened. So this is what I'm saying, the pelvic floor, the ligaments, the structures around it, right? And what else can cause the womb to prolapse? It is not just a baby. So this was another thing a lot of people were saying. Aging and menopause can also cause womb prolapse because you have a drop in estrogen. Again, hormones. Go back to the video about hormones, okay? So when there's a drop in estrogen, this can weaken tissue all over your body. It's not just over there, but all over the body. But since we're talking about womb prolapse in specific terms, aging and menopause can contribute to your womb prolapse if you happen to have one. Okay, my mother, for instance, she is 63 now. She is, I would say, about 10 years post menopause, and she has never had this issue of a womb prolapse, but she's heard of a lot of stories. Okay, so it doesn't happen to everyone. Again, what else causes womb prolapse? If you have a chronic constipation problem, you keep putting pressure down there. Pressure down there can also come from lifting heavy weights wrongly. I'm not saying you can't lift heavy weights. There are some people who do it for exercise. So you like lifting weights, that's fine. But you need to, and if you learn the proper technique, you are being supervised or monitored by someone who knows their stuff, then you would, like a gym trainer, then you would know that you're not supposed to lift using your abdominal muscles. And a lot of people in the gym, they're afraid of hurting their back. But actually, you should also be concerned about your abdominal muscles and your abdomen, the things inside your abdomen, especially when you're a woman. You're supposed to lift with your thighs. We teach that to caregivers, that body mechanics are very important. And if you don't want to hurt your back, you need to lift and do shifting and whatnot using your thighs, because your thighs are the biggest muscles in your body. So that's something to note. Unfortunately, there is such a thing known as genetics. And sometimes you just have the genetic predisposition to have a womb prolapse. Again, it does not happen to every single person. Just because your mother had it does not mean you would automatically have it. When you see or hear the word predisposition in medical terms, it just means that you are at a higher risk of it than another person. But if you take care of yourself to ensure that it doesn't happen, you're doing everything you can to protect yourself from it, then you lower your risks. So someone who doesn't take care of their womb versus a person who has this womb prolapse issue in their genes, but takes care of themselves and their womb very well, the first person is more likely to get the womb prolapse. I've had people commenting on that video saying, "Oh, I'm child free. This is one of the reasons why I don't want to have children." Very unfortunately, if you're a biological woman and you have a womb, there is a chance that a womb prolapse can happen to you. Now, how do you know that you have a womb prolapse? Sometimes it is a feeling of a very heavy load down there. Sometimes it is about pressure. That's what happened to me. I just felt like there was an unusual increase in pressure down there, and I just kept feeling like peeing all the time, but there was no pee. It was just a lot of pressure down there. And for some people, they can actually feel like a bulge. It's definitely uncomfortable. These are some of the very common symptoms that you can get. For me, I mentioned this in the original video. Sex became very uncomfortable. I don't think I would use the word painful. I can't remember exactly how I felt, but it was really, really uncomfortable. And my husband could actually feel that something was wrong. So there was prolapse that was significant enough that it could be felt in the vagina. So what I did was to turn to my masseuse. I have a traditional postnatal slash confinement masseuse, and she came highly recommended by a colleague who had five babies, and this masseuse was her go-to confinement masseuse for all five pregnancies, like postpartum, right? And in Asia, we have a lot of different traditions and cultures. I'm pretty sure it exists in African cultures as well because I've read about it. And so you have magical women, women who can use their hands to, if your baby's in breech, your baby has like the umbilical cord around its neck and all that. Like, I'm talking about women who really know their stuff, people who have been practicing this tradition religiously, like in their line, in their family line. Like the lady that I go to, she is the third generation in her family who does this. So she used to assist her grandmother and then her mother, and then she learned it. It's almost like a gift. And when she touches me, she doesn't even have to start the massage yet. She just touches me, and she can tell me, like, did you do a lot of walking yesterday? Did you do this? You've been taking a lot of cold water. I can feel it. It is insane. It really is like she knows some magic. And so I urge you, if you are talking about getting a postnatal masseuse, somebody who is experienced, please make sure you know that they know their stuff. So I'm going to put that disclaimer out there. It is not just any postnatal masseuse, it is someone who really knows their stuff. And they're usually like older women or women who have learned it from members of their family. Something else that you can do if you have already had your womb prolapse is to engage in pelvic floor physiotherapy. Now, what this looks like, if you go to an actual physiotherapist, you go to your doctor and you get a referral and you go to your physiotherapist, it's going to look a lot like Kegel exercises, but physiotherapists, they have studied therapy, they know the muscles, they know the abdomen, and so they can probably give you more personalized care if you ask me. But yes, you can also perform Kegel exercises at home. There are tons of YouTube videos where you can find out how to do it at home. I was doing it for a while. I am not very disciplined, so that's why I got the womb prolapse. Okay, and so I would urge you to, if you feel like you have some sort of heaviness or pressure down there and you suspect that it's a womb prolapse, please go and see a doctor. Get it looked at first, because the doctor can tell you if it really is a womb prolapse, and they can also tell you how severe it is, because depending on the severity of the situation, there are different solutions that you can try. So a postnatal massage is usually not like a medical thing that's going to be recommended, but it worked for me like twice. I recently had a womb prolapse as well that I did not share in that original video. And this was because I had experienced chronic cough. So remember, I was off the grid for like 4 weeks. I had really, really bad respiratory issues, and I was coughing really badly. Like, I was coughing to a point where I was peeing every time I would cough. So it was that bad. And so you can imagine the pressure down there in my abdomen. Coughing, I don't know how you can cough safely, because when you're lifting something heavy, you can make sure that you're lifting safely, right? You use your thighs, but when you cough, you have to use your abdominal muscles. I don't think there is another way that you can cough safely. So I was coughing really badly, and I had to get her in because I was just not well overall. And then when she came in, she was like, your abdomen is telling me that your womb has dropped very badly. And so she pulled it up again. So it happened again very recently. I have so much background noise, I feel. I'm so sorry. If you kind of know that you have been stressing your abdomen too much, like your lifestyle is such, maybe you have chronic constipation, you are someone who has to do heavy lifting every day for work or something, then do try to look at solutions for that problem first. So if you have chronic constipation, then go get that fixed. If you have a problem with lifting heavy things every day, then make sure you go get a belt that's going to support both your abdomen and your back. Go practice lifting with your thigh. I don't know. Fix that problem before you go to your womb, because even if you try like Kegel exercises and then you're constantly contradicting that by lifting heavy things the wrong way, then it's not going to help much, you see. So, when I was doing research for this topic, I found out about something really interesting. There is apparently a non surgical but invasive. Invasive because, they have to do something inside, but it's not surgery, okay? There is a procedure where they can insert something known as a pessary. So, a pessary is a device that they are going to insert into the womb by through your vagina, okay? And that is going to it's not going to lift your womb, but it's going to help to support your womb and the other structures that are around it, which I think is pretty cool. But of course, as with any procedure, you're going to have pros and cons. This is a silicone, a device that is made out of silicone. But I suppose there are people who are sensitive to anything that is foreign in their bodies, so that's another issue. In terms of surgery, you have two kinds of surgery. Again, that depends on the severity of your prolapse, okay? So you can have a hysteropexy. Okay, so a hysteropexy. So hystero refers to the womb. Pexy in this case is them fixing it by inserting a mesh to lift the womb. It is something that is pretty new, but I personally believe that it is game changing, because prior to the hysteropexy, we only had the last option, which is a hysterectomy. A hysterectomy is the removal of the entire womb. So even if you think that having a baby is not your thing, there are a lot of cons to having your entire womb removed. You're not going to have a period, and you're also going to have some hormonal issues. It's kind of like having menopause much earlier. My own grandmother had to get her womb removed at a pretty young age because she had like a really bad fibroid problem. So sometimes hysterectomy is the only solution when the problem is really big. And luckily now we have this thing known as a hysteropexy. Like I said, it is basically like a womb lift. That's what it is. So you have a facelift, right? This is a womb lift. Prior to this, there was no procedure, no exercise, or nothing that could actually lift the position of the womb, medically, scientifically speaking, which means we're not talking about the postnatal massage. Now, these are just options that you have if your womb has already prolapsed. Again, the severity of the prolapse matters, and don't self diagnose. If you think that you're feeling all these symptoms, you're constantly peeing, you have very bad pressure, heaviness down there, please go see a doctor to get it properly diagnosed. And then after that, you can explore options and see what works for you, especially if you have pain. When you have pain, stop looking for answers on the internet. Go see a doctor. I know this is something that mothers always do. You need to take care of the house. You have a gazillion things to do. You have to take care of your baby. There's no time for you to take care of yourself, never mind actually going to the doctor. But this is very important. And let me tell you, if there is nothing else that you take away from this video, just remember this. Your womb is incredibly important. And when it comes to the womb, you want to try and get it sorted as soon as possible. What can we do if we do not have a womb prolapse yet, and you want to strengthen your womb, you want to strengthen everything in your abdomen anyway to make sure that it never happens. These are some things that you can do. Pelvic floor exercises are also preventive. So if you've already had a womb prolapse and it's in the earlier stages, you can perform Kegel exercises to make sure that it doesn't get worse. Or if you have not yet gotten a womb prolapse, you can still perform Kegel exercises to make sure that your womb and the surrounding structures stay strong and it does not happen. Avoid heavy lifting during the earliest stages of postpartum. It's not very easy, especially when you have other children. They're going to ask you to carry them. Ideally, and this is something that I don't know if it has scientific backing, but in my family, we always say this. If you have had a baby, you can only carry that baby and anything that is around that weight or lighter. So if you have to carry an older child because they're throwing tantrums, and it happens, I know, sit down, get them on your lap, or lie down and get them to surround you. Try your very best not to carry. Being very aware of your core also assists with you understanding and remembering if you are using your abdominal muscles. This is something that I learned very recently. And so, even your posture, right? When you're slouching and when your core isn't engaged, it is very easy not to remember that you might be wrongly using your abdominal muscles. I think core awareness is something that you can do very easily by just constantly remembering and reminding yourself that you're engaging your core and you're only using your abdominal muscles when necessary. And of course, I've talked about this belly binding, and there are different types of belly binding. You have the traditional postnatal belly binding. In many of the cultures that I have researched on, it's always pretty much the same thing. You're getting mummified, like, you know how they use strips of cloth to tightly bind the corpse and then it becomes the mummy, right? They do that to the tummy. And usually it's really, really tight in the cultural bindings, especially postpartum, during the immediate postpartum period. I call this the fourth trimester, but especially that 1 month postpartum. In every one of the Asian cultures that I have seen meaning I've spoken to people who have experienced this, the binding is so uncomfortable, but it works. It works in the sense that it helps to also shrink the womb. So when you're done with that 1 month, you kind of look like you have not had that baby, except if your skin shows it, what with stretch marks or that loose rubberiness. Otherwise, your figure actually goes back to normal. And so, belly binding works for two things. And remember, we're still talking about taking care of your womb so that it doesn't prolapse. We're talking about strengthening your core. We're talking about ensuring that the womb basically doesn't fall. Womb support, that's what we're talking about. But belly binding also works for womb shrinking. And again, this was something that I felt really needed to be addressed because a lot of the comments were kind of telling me that people were confused about, the difference between these two things. Belly binding does two in one, okay? But if you're talking specifically about supporting the womb, we just went through what you can do. If you're talking about shrinking the womb and getting like a flat tummy, that's a whole different story that we'll get into. There is also the kind of belly binding that you can do on your own. The really tight postpartum ones that I'm talking about, you can't do it on your own. You need like two people, or at the very least one person doing it for you. It kind of reminds me of those scenes in the movies that you see during the Victorian times where you need like two maids to assist with the corset binding. It kind of is like that, but instead of a corset, you use like strips of cloth, really long, long cloth. The kind of belly binding that you can do for yourself, they are typically Velcro. So you can just stretch and just put the Velcro on. They're so much easier. When you're really uncomfortable, when you're going to eat, you need a little bit of relaxation at the tummy, then you can take them off. They can look a little bit bulky because they're like straps on, right? So they can look bulky. But if you want to wear a different kind of belly binder under your clothes, under like a tight dress, maybe you're a few months postpartum and you're dressing up, you want to go out, you also have those pants that you can pull, kind of like skims. It's the same concept. So they're all different variations of like a corset. The idea, the concept of a corset is what we're talking about. So you have endless options. Let me know if you want me to show you some of those options. And because I have tried a few of them, I can speak from personal experience. So let me know if you want me to make a video about that. Since we're still on belly binding, and I just spoke to you that there is a difference between supporting the womb and shrinking the womb, and there were a lot of questions about getting a flat belly, right? Now, shrinking the womb is basically about the insides. So you want to make sure your womb, which has stretched to about 500 times its size during pregnancy, now goes back to its original state. This usually happens naturally, especially when you are breastfeeding. The oxytocin that gets released in your brain, oxytocin refers to that happy hormone, okay? That happens when you breastfeed. The more oxytocin you get, the more you start to feel like contractions. Like after the baby is out and you're feeding the baby in your fourth trimester, you feel these similar to pregnancy contractions. They can be really strong. And then after a while, they die down to your period cramps kind of feeling. And that is actually your womb shrinking. And I felt it really strong, really powerfully with my first born. When I was breastfeeding her, it was really bad. But with my second baby, I didn't really feel much. What a lot of people were concerned about is to get that flat belly. And I have this problem as well, where the inside actually is kind of tight, but you still have that hanging belly. And that really is your external stuff. So we're talking about skin. Your skin has stretched during pregnancy, and then now it is loose. It takes a while. Remember, these changes during pregnancy happened over a period of time. 9 months, 10 months, right? And then it's going to take around that time a lot of work, a lot of effort on your part for it to actually shrink. So it's going to take some time and quite a bit of effort on our part to get the skin to kind of go back to normal. When you rapidly lose weight, it is a problem that people face as well. So it is a normal skin elasticity issue. Another reason for your loose skin like that could be diastasis recti, which is basically a separation of your abdominal muscles. Another problem that causes the um, drooping or hanging belly is that our hormones, because we're females, we have all these problems with our hormones. Now, our hormones want to give that area a bit of support. And so, naturally, after a delivery, we tend to have more fat distribution and storage at the abdominal area. That's just your body's natural way of giving some love to that area. Very unfortunate. It matters a lot to you. One of the best things that you can do for yourself is to go get some core rehab. So you speak to a physiotherapist and you dedicate some effort and time to fixing this if you think of it as an issue. I personally, I've talked about this in another video as well. I still am not completely okay with what I see in the mirror. I'm definitely going back to, I see some resemblance of myself from the past, but it's not the same. And I do understand and acknowledge the fact that it's going to take a longer time. So here's me sending love out there to you if you feel like you are really disturbed by this. And finally, I want to end off with this. Your womb is not weak, it is powerful. But just like any other part of your body, it requires a lot of care and support. Please, please, please understand that this video and everything that I've shared is based on my experience, my encounters with people, my own research. And so I think that everything that you see like this content should be taken not as 100% facts. You need to do your own research, and of course what works for me might not work for you. Please understand that this does not substitute in any way any medical advice. I've said this before and I'm going to say this one more time. If you have any pain or discomfort, do not look for answers on the internet. Even if the person who is talking knows their stuff, you are an individual. If you are having an individual problem with your individual self, you need to get it checked by a doctor who can see you, perform tests, look at you, like do a proper medical examination, not just give you general advice over the internet. If you found this information helpful, then please consider subscribing. If you think there is someone out there who needs to watch this, who needs to hear this, then do share this video. You can also join the community on TikTok. It is the same thing to search for, the Cashmere Couch, and I'll see you very soon in my next video. Goodbye.